Welcome back. I'm the Intense MD, a double board certified intensivist, here to give you an inside look into the intensive care unit. As a disclaimer, I am a physician, but I am not your physician. If you have any concerns that you have any of the medical conditions that I've mentioned, then it's a good idea to visit your own personal doctor for an assessment. And again, as I've said in the two prior videos, I'm not a kidney doctor. We are going to talk about kidney disease again in this video, but we are not going to go into the nitty-gritty details. This is just an overview. Today we're talking about end-stage renal disease, and this is the final stage, hence the name, of chronic kidney disease. This is when somebody's kidney disease has progressed so much that the kidneys no longer properly do their function, and the patient is recommended to be placed on dialysis and or evaluated for a kidney transplant. So end-stage renal disease can be caused by any of the things that I mentioned in the past two videos that cause acute or chronic kidney disease. It's most likely a progression of CKD, and the most common causes of chronic kidney disease are hypertension and diabetes. As I said in the prior video, there are some autoimmune conditions and genetic conditions that can contribute to kidney disease as well. The symptoms of end-stage renal disease are very similar to those of chronic kidney disease. Somebody may not realize that they are progressing towards end-stage renal disease because they have been living with chronic kidney disease for so long that they're accustomed to having these symptoms. But fatigue, difficulty sleeping, trouble breathing, a lot of edema or excess fluid on the body are just some examples of chronic kidney disease and end-stage renal disease. Like I said in my chronic kidney disease video, there is no way to reverse the damage that has been done to the kidneys. If you have reached the end stage, the options for you are to pursue dialysis, to consider for a kidney transplant, or consider hospice if neither of those are something that you wish. You always have options in healthcare if you want to pursue a treatment or not. So if you do not want to pursue dialysis and you do not want to pursue a transplant, then going on hospice for end-stage renal disease is an acceptable option. So the most common treatment is dialysis. The purpose of dialysis is to do the job that the kidneys are no longer able to do. And this is to remove the excess waste and excess fluid from a patient's body. The most common type of dialysis, at least in the United States, is hemodialysis. This is when a patient may go to a dialysis center or medical facility to have dialysis 3 times per week, usually Monday, Wednesday, and Friday, or Tuesday, Thursday, and Saturday. There is the option for home hemodialysis, but this can be cost prohibitive. In order to get dialyzed, a patient needs dialysis access. So as I said in my last video about acute kidney injury, if somebody rapidly needs to go on dialysis, then they most likely will have a temporary hemodialysis catheter or a tunneled hemodialysis catheter placed in their jugular vein or their femoral vein. An AV fistula or arterial venous fistula is the option for a more long-term option, but this does take several months to mature. Over that time, it cannot be used for dialysis. So someone may have a temporary line placed, a tunnel line placed while they're waiting for their fistula to mature. Many times when somebody is headed towards end-stage renal disease, their kidney doctor talks about AV fistula placement up front, so by the time they need dialysis, it is mature. In hemodialysis, the machine is hooked up to the patient's dialysis access point. At that time, the blood is taken away from the body and put through the dialysis machine, which helps filter out the toxins in the blood. There are different filters in dialysis that are prescribed by the nephrologist for that particular patient to determine what dose of dialysis they need. Once the blood is run through the machine, it's returned to the body. So this usually is a several hour process to make sure that the blood has been cleaned and the appropriate amount of fluid is removed from the body. Some of these things are based on the individual patient and what their nephrologist has prescribed for them. The second form of dialysis is peritoneal dialysis. This is less common in the United States. This is when the peritoneal cavity or the abdomen is used as the filter. This access point for dialysis is a catheter that is placed in the abdomen. and the patient is able to fill their abdomen with a fluid called dialysate. It sits in their abdomen for several hours while it does its job, and then the patient removes it from their abdomen. Sometimes a patient will do their peritoneal dialysis overnight while they're sleeping. This allows for more flexibility with some patients who don't want to be tethered to a dialysis center for 3 times a week, because many times you have to go to the same dialysis center, the same appointment, the same time, those 3 days a week. So people who travel often or people who do not want to leave their house 3 times a week have a preference for peritoneal dialysis. But this depends on the patient's ability to do their own dialysis. So there's pros and cons to each type of dialysis. Some of the pros of doing hemodialysis: one, it's very effective in removing waste and fluid from the body. Two, it's done at a medical facility. So while some people might view that as a con, if you're having any issues, then there's medical personnel right there monitoring you. Of course, I said previously that home dialysis is an option. So if you're doing home dialysis, then that's not a pro. If you're doing home dialysis, then you don't have medical personnel available. But for people at a dialysis center, then that is a perk. And hemodialysis is fast. It takes a couple hours, usually 3 to 4 hours. Some of the downsides to hemodialysis are, again, you do have to go to a center, you do have to leave your house. It's the same appointment time every single week, 3 times a week. Since hemodialysis is rapid, it can cause some lower blood pressure. It might cause a patient to have symptoms such as dizziness, might have muscle cramps or nausea. And sometimes hemodialysis is uncomfortable for somebody because if you have an AV fistula, you still need to have it accessed with the needle every single time. The pros of peritoneal dialysis are, as I said, it can be done at home. So you don't have to worry about attending the same appointment time 3 times a week at at a dialysis center. You can do it at home, especially if there's inclement weather, you don't want to leave your house, there's snow, there's ice, the power is out. You can still do your peritoneal dialysis. It's also a gentler process than hemodialysis. Peritoneal dialysis is slower, so people are less likely to have those symptoms that they get with the faster hemodialysis, such as dizziness, low blood pressure, nausea. And sometimes peritoneal dialysis has been shown to help preserve kidney function. Some of the cons of peritoneal dialysis are: one, it's not as effective as hemodialysis. So there's some people who just do not tolerate peritoneal dialysis. They might trial it at home for a little bit, but they do ultimately end up in the hospital with worsening renal failure, needing to go on hemodialysis. And I have seen this happen several times where they'll come into the intensive care unit with worsening renal failure. They're not getting effective dialysis through peritoneal dialysis, and they need to convert to HD in the hospital. Another downside is they do have to go through abdominal surgery to have that catheter placed. Another thing that I have seen with peritoneal dialysis is this catheter gets infected and then their entire abdomen and peritoneum is infected. And many times that does lead to the catheter having to be removed and the patient having to convert to hemodialysis. And peritoneal dialysis is time consuming. It's a longer session than HD. So even though you're at home, you're still undergoing this process for several hours. So another option for people with end-stage renal disease is kidney transplant. And I'm going to go in depth in another video about organ transplant in general, because there are particular criteria for a patient to receive an organ donation, and there is a whole process to go through for the workup and to be listed. So, as a brief overview, for people who are needing a kidney transplant, they can receive a living donor kidney transplant or a deceased donor kidney transplant. Typically, the living donor is someone that they know, typically a family member. A deceased donor is when they are listed, they wait for an organ that is a match. In terms of who can receive a kidney transplant, this might vary transplant center to transplant center because each transplant center has slightly different criteria. The decision if somebody is a candidate or not is made by a committee, and this is for any organ at any hospital. There is a review board who goes over the case, and multiple physicians decide if that patient can be listed or not. And when I talk about organ transplant in general, I'll go more in depth about what that means and what happens. But like I said, a patient does need to go through some testing to make sure they're a candidate. One of the major things that might prohibit somebody from getting an organ is if they have any other type of medical illness that their life expectancy is less than a year, such as an aggressive malignancy. The transplant is performed by a qualified transplant surgeon, and they connect the donor kidney's vasculature and ureter, their urinary tract system, to the donor kidney. After the transplant, the patient needs to take immunosuppression to suppress their own immune system so their body does not reject the transplant. So, getting a kidney transplant can help somebody come off of dialysis. So, once they get the kidney transplant and it's functional, then they no longer need to go to dialysis. Someone might be able to avoid dialysis in general if they get a kidney transplant, such as Selena Gomez. Unfortunately, sometimes do kidney transplants fail and the patient remains dialysis dependent even after the procedure. But that being said, many people consider kidney transplant because it does have the potential to increase their quality of life. I hope you enjoyed this series about kidney failure. I'll be back next week with the next organ system.